Today we're focusing on the soaring cost of drugs after the makers of EpiPen mistakenly assumed Americans susceptible of anaphylactic shock were somehow immune to sticker shock. But EpiPen is just the beginning. We worked with our investigative partners all over the country to identify more than 100 other common drugs that have skyrocketed in price over the past 4 years. They include popular generics such as naproxen, tetracycline, doxycycline, and countless others I can't pronounce. Among those, a generic steroid cream for an itchy scalp used by one of our viewers, John Munn, who contacted us after his $23 prescription for that scalp inched up a little bit in price recently.
It was like almost $130. And I said, that can't be right. Can you double check that? And they said, no, I checked again and that's what we charge. That's outrageous.
And Munn knows what outrageous prices are for drugs. He toured the country as a roadie with some of the biggest bands in the 1970s. But now at 60 years old, the biggest high Munn gets these days can be found on the bottom line of his prescription bill.
Where are we coming to when our health care is based on, can you afford to live?
And that is frightening, because regardless of your feelings on Obamacare, most Americans believe everyone should have access to affordable health care. And that isn't the case right now. We looked at the price of 356 prescription drugs all across the country, and the average cost of those drugs has doubled in just the last 4 years. One drug, tetracycline, a common acne drug for teenagers, used to cost 7 cents a pill in 2012. Now, a zit-popping $8.54 a pill. How steep is that? More than 12,000%. That yodeler is going to be in a lot of pain, mostly because he can't afford his medication anymore, and he's not alone. Soaring drug prices, often without any justification, have affected everyday Americans' abilities to get the life-saving drugs they need, from insulin to EpiPens to cancer drugs. Listen to this heartbreaking story from an oncologist in Texas.
Just last week I was talking to a patient who needs a drug that can offer her some significant benefit, but she was making real decisions about, well, do I pay the light bill or do I get this medication?
The job of an oncologist is hard enough, fighting cancer every day. We shouldn't be making it harder by forcing them to face new issues of overexpensive drugs. Which takes us back to our friend John Munn. An itchy scalp wasn't his only head scratcher. Sorry if you don't like the joke. Blame the joke writer. Munn wanted to find out why the price of a generic drug he's been using in the exact same form since 1989 suddenly spiked. Traditionally, drug companies point to the cost of research and development, and it makes sense to incentivize big pharma's continued innovation of life-saving drugs. But this is big pharma we're talking about. We found the big surges in prices actually correlated with big surges in their advertising and marketing budgets. And our friend John didn't like that.
Oh, research and development, we have to put, because we spent billions for this drug. No, you didn't. You acquired this from another company, and all you're doing is reproducing it at a very small, minuscule cost, and you're jacking up the price hundreds of percents.
Remember, pharmaceutical executives don't get their adrenaline from an EpiPen. They get it from your misery. And Congress can grill them all they want, but the problem is that mega mergers create monopolies. The FDA can't stop it. And shocker, there's been little support to curb price gouging in Washington. Sure, Senator John McCain sponsored a bipartisan bill to force drug companies to justify price hikes. But as we learned in Schoolhouse Rock, that bill is really nothing more but a sad little scrap of paper nobody's paying attention to on Capitol Hill. We'll be digging deeper into these issues over the next few days. Who's choosing pharma over you, and who's getting rich on it all? Because knowing how much your medical care is going to cost you shouldn't be a game of Price is Right.